Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine at University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions in patient safety. This is topic 6, understanding and managing clinical risk. Learning objectives of this session: define healthcare risk, describe risk management activities, implement self-care method to reduce your role in error. Discuss the learning opportunities from risk identification. So why clinical risk is relevant to patient safety? Clinical risk management is specifically is concerned with improving the quality and safety of healthcare service by identifying the circumstances and opportunities that put patients at risk of harm and acting to prevent or control those risks. Risk management is routine in some industries and has traditionally been associated with reducing failure and also limiting litigation and cost. It is very routine in aviation and high risk industries. To avoid problems related to risk, healthcare organizations use different methods to manage risk. Successful risk management program depend on creating and maintaining safe system of care designed to reduce adverse event and improve human performance. Many hospitals routinely collect data about and reporting patient falls, medication errors, retain swabs, and also identification of patient and transfusion reaction. We have to keep in mind that health service with culture of reporting is safer than one that without reporting. Interestingly, we see that nurses are very diligent in reporting compared to the doctors. Anyhow, reporting risks like a whistleblower, it tends to raise concern. It can help administration to correct and rectify the problem. Risk management will work on improving safety and quality, and also it tends to minimize the risk of litigation and other losses. In addition, when you address them and give feedback to your staff, it helps to improve their morale. In risk management, usually it goes through 4 steps. Risk identification, then we have to assess the frequency and severity of the risk, and then we implement risk elimination and risk reduction, and at the same time we need to study the cost because it has to be cost effectively, and then this will help us to prioritize our intervention. Clinical risk management activity depend on incident monitoring, sentinel event, role of complaint in improving care, complaints and concern where the individual is responsible, or also coronial investigation. WHO define an incident as an event or circumstance that could have or did lead to unintended or unnecessary harm to a person or a complaint or loss or damage. Organization need to monitor incident, and they need to discuss them during the routine round or in a dedicated quality improvement meeting, and also they have to adopt a culture of no shame and no blame. In culture of shaming and blaming, people will underreport incident. The incident in each organization, they tend to vary. Like here, we see that false is very commonly reported. Other injuries is also are common, medication error, clinical process like wrong diagnosis, inappropriate treatment, it can happen in up to 10%. Some stuff are relatively better control and the incidents are low, like the transfusion. When the people follow the protocols, then the incidents are low. Also, oxygen administration problems are also low. One of the way we monitor risk, it's about centennial event. This unexpected occurrence involving death or serious physical or psychological injury, and include any process variation for which a recurrence would carry a significant chance of serious adverse outcome. Sentinel event is an adverse event that should never be allowed to happen. In some institutions, they define them like surgery on wrong patient or wrong body site, incompatible blood transfusion, medication error leading to death, wrong tooth being removed, wrong drug being dispensed, newborn being given to wrong mother, and other catastrophic event. Another method of risk management about complaints. Complaints is defined as an expression of dissatisfaction by patient, family member, or carer with the provided health care. While complaints from patient and family may be uncomfortable to deal with, they are very good opportunities for improving professional practice and restoring trust and relationship between the patient and family member. Complaints can be avoided when we provide good care. Whenever we leave a patient, we want to make sure that the patient is satisfied, his concerns are addressed. So never leaving counter, letting the patient feel discounted, dismissed, or diminished in any way. So complaints can assist in maintaining standard, reduce the frequency of litigation if we address them well and give good explanation, help maintain trust in the profession, encourage self-assessment so we can reflect in ourselves and improve, and it also protect the public interest. Coronial investigations, also one of the methods of risk management. Most countries have some system of establishing cause of death, specifically appointed people called coroners in many countries are responsible for investigating this in situation where the cause is not clear or there is uncertainty or when there is a concern of unethical or illegal activity. Coroners often have a broader power than a court of law, and after reporting the fact will make recommendations and suggestions to addressing system-wide problem. To manage risk, it's important to maintain fitness to practice. There is certain requirement for provider to practice, including credentialing, accreditation, and registration. Credentialing, many hospitals, clinic, and health service have credentialing process in place to check whether the professional or provider has the required skills, knowledge to undertake a specific procedure or treatment. So they make sure you fit the job. Accreditation is a formal process to ensure delivery of safe, high quality healthcare based on a standard and process devised and developed by healthcare professional for healthcare service. It can also refer to public recognition of achievement by healthcare organization of the requirement of national care standards. Registration, most countries have a system for registering the provider like the medical council. They make sure they get graduated from accredited schools and they go through certain training, and sometimes it requires certain CMEs and continuous professional development activities. For risk management, we mentioned the organization responsibility. by identifying the risk through different methods like incident, complaint, coronal, and sentinel event. But also the provider, they have to monitor themselves. They need to know when they are tired, exhausted, when there is fatigue, and how to manage that, and how to report that when they are stressed or having mental problem. When the working environment, it can carry some risk for them or for the patient, and presence of supervision, especially for young provider, and also they need to improve their communication skills and communication styles. So take home healthcare risk can be addressed by risk identification, assessment, and measurement of severity, and then risk mitigation. Ways of risk identification include incident monitoring, sentinel event, coronial investigation, assessing complaints. Risk analysis can provide opportunities for learning and improvement. Fitness to practice require credentialing, accreditation, and registration. Provider can reduce risk by managing fatigue and stress, function well in a team, maintain good medical record, and ask for help during uncertainty. Practice, participate in meetings that discuss risk management and patient safety. Respond appropriately to patient and family after adverse event. Respond appropriately to complaint, and thank you.